Hi everybody, my name is Kristen Kelly and I am a registered nurse, Master's of Public Health and Epidemiology, and I am certified in infection control. I'm also a mom to 3 boys and I'm happy to bring you the latest and greatest as it relates to COVID-19 for your weekly update from Medela. So thanks for joining us today. So I got a couple questions related to what is the next steps for social distancing. Well, you can see that social distancing in many communities has slowed the pace of the virus, which is great news. So there is some chatter within federal government and local governance that may move forward to reduce or lift some of the bans of social distancing. More will come on this and we'll probably update that more next week. But for now, we are recommending that you stay socially distanced, limit or avoid trips outside of your home as much as possible, and then stay within 6 feet from other people when you do leave your home or you're in your community or out and about. Next question that we got for pregnant moms: what can I do to stay healthy at this time? So this is a great question. What we recommend are often not different from other times. We stay hydrated, really try to eat good nutrition, as many fruits and vegetables as you can, and to get enough rest, which I know is sometimes hard for pregnant and new moms, but that is something to strive for. Also, make sure that you clean your hands more frequently, which is something different. During COVID times, we're really recommending frequent hand hygiene. Put your hand sanitizer in your pocket, take it with you when you do go out and about, and try to just be vigilant when your hands are dirty, that you want to try to clean them. That interrupts the spread of the virus and helps us all to stay healthier with clean hands. What do I do if I experience some of the symptoms of the virus? I think first, don't panic. Just because you have some cold and flu symptoms does not mean that it is for sure COVID, as there still is some flu in circulation. So not all fever is a COVID fever, but monitor for these signs and symptoms: fever, dizziness, shortness of breath, and cough. And if in doubt, notify your healthcare provider. They may refer you to one of the testing centers that is starting to expand in the community. And will it hurt my unborn baby if I am infected? Is there any updated information related to this? Great question. There still are not a lot of good studies since I updated this last week. What we do know is there are a lot of unknowns related to COVID and pregnant moms, but there have not been any documented case studies of moms passing COVID to their babies in the womb. We do know that viral transmission after delivery is possible. So if a mom does have COVID and you have signs or symptoms, they will likely ensure that you wear a mask, particularly when breastfeeding. You may express to a bottle and have someone that is not sick feed your baby. And they may also reduce visitation or potentially screen other members of the family in your home. So a couple things that we have seen in the OB world is that they are starting to screen pregnant moms prior to delivery, just as an extra benefit. So you'll want to check with your delivering hospital where you plan to deliver, to inquire about what they're doing for COVID screening prior to your delivery. That may just help you prepare and have all the information and know what to expect. What do I do if I am diagnosed with COVID-19 is a question. The decision to breastfeed is a shared decision between you and your baby's healthcare provider. Recommendations to follow are hand hygiene and wearing a mask, like we said. And of course, stay calm, stay hydrated, talk to your physician, and just use good separation and clean and dirty principles when you and your baby are close. So to date, there still have not been any virus that's been detected in breast milk, which is great news. And for more general information about cleaning and sanitizing your breast pumps, check with the CDC website and submit your questions to us, and we'll be happy to answer that in our next session. Medela is very committed to keeping you up to date with the latest and greatest resources, and they're working hard to put all the latest information on their website. So click on the link in the video to get a link to that. And in closing, we look forward to seeing you all next week. Stay safe and stay healthy. Thanks.